There's no exaggeration to say metro hospitals are seeing nightmarish scenarios. Missouri and Illinois are seeing record 7-day COVID infection rates tonight.
And new data shows hospitals are in dire positions with capacity shrinking. According to the St. Louis Metropolitan Pandemic Task Force, area hospitals are at 89% capacity. ICUs sit at 81% full.
While healthcare workers are overloaded, they're expressing concerns about Missouri's COVID emergency order that's no longer in place. Our Paige Halsey explains why some say losing that order could hinder staff and affect your health care. Paige?
Yeah, Corey, that emergency order had given hospitals like BJC here more flexibility when it came to things like bed capacity, onboard training, virtual visits with patients, and which staff members could do what tasks. Now, each hospital has to get a specific waiver for each of those things through a various state department, and frontline workers feel like they're stuck in the middle of all this red tape.
Frontline workers like Denise Huffman are exhausted.
How would you describe the last 2 years in the ICU?
They have been emotionally, physically, spiritually, and mentally draining.
As an ICU nurse at Barnes Jewish St. Peter's, she worries the end of the emergency order sends the wrong message, that the pandemic is over, when that's a far cry from the reality she sees every day.
We're seeing younger people die. We're seeing people dying who are leaving behind young children and teenagers.
While she cares for patients, hospital leaders across the St. Louis area say they're busy trying to lock in the waivers for many of the issues that the emergency order had addressed.
The waivers have some impact on staffing, sort of the ability to get people on board quickly and to shuffle roles. But it's not the biggest impediment to staffing. Right now, it's simply the lack of availability of people who are willing to come in and work in the hospital right now.
Do you feel like the end of this emergency order impacted morale more than it really has impacted operations in the past week?
It was the notion that we were no longer in a public health crisis. And I think that is definitely not how it feels if you're in the health system trying to take care of a massive number of patients.
I asked the governor's office if they were considering re-implementing any part of the emergency order. They only said, quote, "We stand ready to assist if needed." Huffman, though, worries some people, including in government, just don't get it.
It doesn't seem real to the other people, to the general public. COVID does not seem real, and it is very real, and we are still seeing people die.
Now, if there is any silver lining to this emergency order expiring, leaders here at BJC that I talked to today say now they can push for legislative change for the long term. They can try to get rid of some of those outdated policies and push to keep on a statewide level some of the things that they could see did work during this pandemic. But even though the Missouri legislative session started just today, that wish list could take a backseat to a litany of other issues already in line. We're live in St. Louis. Paige Halsey, News 4.